Hello everyone, I'm Adam, your companion on the journey of parenting and emotional healing for mothers and babies. In today's video, we're going to explore a very common situation that often causes parents to worry. When a baby who usually feeds well suddenly refuses the bottle, cries, and becomes fussy. Many parents have asked me, why did my baby feed so well yesterday but refuse the bottle today? Did I do something wrong? Is my baby sick? Actually, most of these situations have clear and manageable causes. The key is not to panic, but to understand what's happening. Respond correctly and then gently support your baby back to balance. Let's dive deep into the main reasons why babies suddenly stop bottle feeding and how to handle each one effectively. 1. Mouth sores or oral thrush. The silent cause of pain, one of the most common reasons, is mouth sores or oral thrush. Small blisters, ulcers, or white patches inside the mouth can make feeding painful. When the bottle nipple touches the sore area, your baby feels discomfort and instinctively refuses to feed. Signs to watch for: baby cries during feeding or latches and then pulls away. White patches, blisters, or ulcers inside the mouth. Mild bad breath or reduced appetite. Gentle solutions: clean the mouth with soft gauze soaked in saline. Offer breastfeeding if possible, since it's more soothing than bottle feeding. Don't force the bottle. Try alternative feeding methods temporarily, cup, spoon. See a pediatrician if the sores spread or persist. 2. Sore throat or mild respiratory infection. Sometimes babies refuse to feed because of a sore throat caused by a virus, allergy, or weather changes. Swallowing can hurt, making bottle feeding especially uncomfortable. Common signs: baby takes only a few sips, then cries. Mild coughing, nasal congestion, or hoarseness. Feeds poorly on both bottle and breast. What you can do: keep your baby warm and hydrated. Use saline drops to clear nasal congestion. Offer smaller, more frequent feeds. See a doctor if symptoms persist or baby develops a fever. 3. Teething, a sensitive transition phase. Between 4 to 8 months, many babies begin teething. Swollen, itchy, or tender gums make sucking painful. When the nipple touches the gums, your baby may reject the bottle and cry. Recognizable signs: constantly chewing on hands or toys. Red, swollen gums and excessive drooling. Fussiness and poor sleep. Helpful steps: let baby chew on a chilled teething toy before feeding. Use a soft, flexible nipple. Break feedings into shorter sessions. This is temporary. Once the tooth breaks through, feeding usually improves. 4. Digestive discomfort or bloating. A sensitive digestive system can also make babies refuse the bottle. If the stomach feels tight, full of gas, or hasn't digested the previous feed, taking in more milk can be very uncomfortable. Typical signs: arching back or squirming after feeding. Trouble burping. Hard, bloated tummy. What helps? Burp your baby after each feed. Gently massage the tummy clockwise. Feed in an upright position to reduce air intake. Consult a doctor if symptoms are persistent. 5. Nipple or bottle issues. Sometimes the problem isn't the baby at all. It's the bottle. A nipple with the wrong flow speed, too fast or too slow, too hard, or with a strange smell can cause refusal. Signs: baby spits out the nipple but still breastfeeds well. Cries or gets frustrated during feeding. Sudden refusal after switching bottles. Solutions: check nipple flow rate and softness. Replace worn-out nipples. Transition to a new bottle gradually. 6. Psychological or environmental factors. Babies are incredibly sensitive to their surroundings and the emotions of their caregivers. A noisy room, unfamiliar person feeding, or a stressed parent can make feeding uncomfortable and lead to refusal. Signs: baby feeds only with a specific person. Feeds better in quiet, familiar settings. Feeds well at night, but struggles during the day. How to help: create a calm, quiet environment. Stay relaxed and gentle when feeding. Keep a consistent feeding routine. 7. Growth spurts, natural feeding changes. During growth spurts, babies' appetite and sleep patterns fluctuate. Some babies feed more, others feed less. This is usually temporary and not a sign of illness. Signs: sudden changes in feeding amount. No other signs of sickness. Normal weight gain afterward. What to do? Don't panic or force feed. Follow your baby's natural hunger cues. Things typically return to normal in a few days. 8. Your emotional state matters. This is something many parents overlook. Your emotions affect your baby. If you're anxious, frustrated, or tense because your baby isn't feeding, they can feel it and become even more resistant. Important reminders. Don't force the bottle or push it into their mouth. Hold your baby calmly. Speak softly. Try again later when both of you are relaxed. Healing starts with your calmness. 9. When to see a pediatrician. Most cases of bottle refusal can be managed gently at home. But you should see a doctor if baby refuses all feeds for more than 12 hours, shows fever, cough, or difficulty breathing, has visible mouth sores or thrush that spreads, shows signs of dehydration, fewer than 4 wet diapers, day. 10. Love, patience, and connection are the real solutions. Parenting isn't just about feeding, it's about building emotional safety and connection. When your baby refuses the bottle, they are not being difficult. They're communicating. Once you understand their signals, everything becomes much easier. Sometimes all it takes is a warm hug at a quiet space. A little patience, and your baby will return to normal feeding. Final message: if your baby suddenly refuses the bottle, don't panic. Don't blame yourself. Observe your baby. Listen to their signals. Address the cause gently, with love, knowledge, and patience. Your baby will feed normally again, and you'll grow stronger as a parent. If you found this video helpful, don't forget to like, share, and subscribe to my channel for more gentle, healing parenting guidance.